Good day, everyone. I'm Ellaine Joy Eusebio from Romblon State University, and I'm presenting to you our research titled The Effects of COVID-19 Perceived Risk, Trust in Government, and Preventive Measures on Restaurant Visit and Tension among Business Students in Tablas, Romblon. The recent coronavirus outbreak, which started in Wuhan, China in 2019, has already infected more than 500 million people worldwide. Governments from all over the world have imposed lockdowns and community quarantine to control the virus transmission. Various industries are affected, and food services are not an exception. The food service industry plays an essential role in the Philippine economy by contributing 3% to its gross domestic product. Due to the COVID-19 pandemic, the Philippine food sector only grew $11 billion in 2020 from the expected $16 billion from USDA. So the study conducted by Yang et al. In 2020 revealed that the pandemic greatly affected the demand of restaurants. Further, according to the group Defend Jobs Philippines, 80% of food services establishments incurred losses due to lockdowns. Now, dining in a restaurant has raised a lot of issues among customers during the pandemic. Thus, the research problem that this study would like to answer is, what are the factors affecting restaurant visit and tension? Shabazz et al. In 2020 mentioned that if a person infected by the virus gets inside the restaurant, they can also infect anything they touch, which can eventually cause virus transmission. So this could be one of the possible reasons why customers are hesitant to dine in a restaurant. Their perceived risk of COVID-19 can negatively affect their intention to visit. Thus, it is essential to practice preventive measures such as social distancing and disinfection, among others, inside the facility. If restaurant owners and managers observe these preventive measures or practices, this will lead to good customer visit and tension. However, research on customers' perception of restaurant preventive practices and their effect on behaviors is currently lacking, according to Wei et al. In 2021. Accordingly, the actions and policies imposed by authorities can also affect people's perception of risk. Moreover, social trust factors such as trust in government and then health surveillance authorities can also affect consumers' decisions, specifically the restaurant visit and tension. Thus, the objective of this study is to explore the effects of perceived risk, preventive measures, trust in government on restaurant visit and tension. Bei and Zhang in 2020 used the Health Belief Framework, or HBF, to explain how health-promoting behavior minimizes health risk. So they proposed that when individuals avoid health risk, they expect a particular health-promoting behavior to reduce that risk. Grounded in HBF, our study identified the factors influencing consumer behavior, specifically visit and tension amid the pandemic. Now, according to the social theory of gender, women are more concerned about health and safety, according to Davidson and Fudenberg in 1996. Previous researchers have studied how men and women differ in perceiving risk and buying intention. In online purchasing, women perceive a higher level of risk than men, according to Garbarino and Skalovitz in 2004. In the face of the pandemic, females are also more vulnerable, manifest a higher level of COVID-19 risk perception and preventive behaviors against the virus. That's according to Yildirim et al. In 2020. So in this study, we explored the role of gender on the relationship between these factors and restaurant visit and tension. Okay, so we employed a stratified random sampling technique. Okay, so this is a quantitative method, and we employed a stratified random sampling technique. So the survey respondents are business students from the College of Business and Accountancy in Romblon State University's main campus, or the CBARSU. As a prerequisite in answering the survey questionnaire, student respondents must be officially enrolled during the first semester of the academic year 2021-2022. They should also be at least 18 years old and above at the time of data gathering. So we adapted survey items from existing literatures, and we also conducted reliability tests. Based on the results, all the items used were significant to measure the research variables, since all the Cronbach alpha values derived were above 0.7. We utilized Jamovo software, and we conducted descriptive statistics, t-test, multiple linear regression, and moderations. So statistical analysis results indicated that 6% were from the Bachelor of Science in Accountancy department, 42% were enrolled in the BSBA Financial Management Program. 15% were from Bachelor of Science in Business Administration Operations Management Program, and 37% were in Bachelor of Science in Hospitality Management Department. 34% of the respondents were on their first year level, 22% were on their second year level, 24% were on their third year level, and 20% were already on their fourth year. When it comes to gender, 77% were females, while 23% were males. So the results show that females, had a higher level of perceived risk, preventive measures expectations in restaurants, and trust in government than males. On the other hand, females had a lower restaurant visit intention than males. However, the differences in the level of perceived risk, preventive measures expectations, trust in government to manage the pandemic, and restaurant visit intention were all not significant. The results of the multiple linear regression model was not significant. Perceived risk did not significantly predict visit intention. Also, trust in government did not significantly predict visit intention. Finally, preventive measures did not significantly predict visit intention. Since the first condition for moderation, that the causal predictor variables, perceived risk, trust in government, and preventive measures must significantly predict restaurant visit intention, was not met, moderations on the three relationships were also not supported. So this study provides new information on the relationship between risks related to health and behavioral intention. Specifically, the following are its contribution to the existing literature. Females have a higher level of risk perception of COVID, trust in government, and preventive measures expectations than males. So it confirms the studies of Davidson and Frudenborg in 1996, Garbarino and Skalevitz in 2004, and Yildirim et al. In 2020. Moreover, the perceived risk did not significantly influence customers' intention, and it confirms the findings of Gan and Wang in 2017 and Leung and Chai in 2021. However, it contradicts the results of the previous studies. Trust in government did not significantly predict restaurant visit intention, and it confirms Hakim et al. In 2021 studies. Finally, preventive measures did not significantly affect restaurant visit intention, and it supports the findings of Wei et al. In 2021. However, it opposes Yildirim et al. 2020 findings. Now, restaurant owners need to know the factors affecting the customer's decision to visit restaurants. They use this information in developing their marketing strategies. However, based on the results, the variables used in our study were not significant factors affecting restaurant visit intention. However, it is worth noting that business students are worried about contracting COVID-19 while ordering in a restaurant, and they find it very risky on how it will be performed. Owners and managers should address this important issue. Since business students expect restaurants to observe preventive practices inside their establishments, restaurants should strictly observe the following COVID-19 preventive measures among their employees, such as a frequent hand washing, use of hand sanitizers, and wearing a face covering. They should also ensure that the facility is thoroughly sanitized and hand sanitizer is readily available to guests. Further, the government and policymakers should also continuously improve their COVID-19 pandemic management. Business students trust them primarily on disseminating information and news about the COVID-19 situation. Okay? So government and restaurant business owners can utilize social media to convey assurance and a sense of safety inside the restaurant facility to reduce the customer's perception of risk. So, of course, this study has its own limitations. First, we framed this study in Romblon, where the number of cases is not as high compared to other provinces. Thus, the results may not be the same for places with higher number of cases. Next, this study based the results on the whole sample. However, females were more represented than males. There could possibly be a slight variation should there be an equal chance of both gender being represented. Finally, respondents were college students. Majority were 18 to 23 years old. So this age group has a lower risk of contracting the virus since risk of COVID-19 comes with increasing age. Thus, the age of respondents probably affected our results. Future research can replicate the study on older group in the same province or in the other provinces to compare the results. Older consumers and consumers in high-risk areas or regions may have different perception of risk, different levels of trust in government, and different expectations of restaurants' preventive measures. Future scholars may also study other factors affecting restaurant visit intention, such as quarantine protocols, since restrictions prevent customers from going out. Maraming salamat sa inyong pag-promote, or thank you for listening.